So my task is just to set out the evidence as we know it to date about ageing on the Mornington Peninsula, and we're very much tying our population health analysis to socioeconomic status and all the indicators that tell us that poor health resides with low income, poor access and equity issues. So I'm just going to outline the basics of the data, and I'm happy to take questions later. I won't go through the objectives of Medicare locals again, Michael's already done that. But just to clarify what our catchment is, we have two local government areas, the Frankston City Council area and the Mornington Peninsula Shire. And within those two LGAs, we have 5 statistical local areas. And a lot of the data analysis that we've been doing is based on those geographic classifications that come from the Australian Bureau of Statistics. That said, sometime this year, the ABS is going to release new boundaries. So we'll get to do it all again on the new boundaries. But in fact, the new boundaries will be much more sensitive. They'll be smaller areas, SA 1, 2, 3, 4, 5. SA 1 will be about 1,000 households, which is going to give us much more what we call granular analysis that enables us to focus very much on those small areas where we know disadvantage resides. So far, we've identified 4 probably areas where we wish to focus a lot of our energy, not necessarily all of it, but we certainly need to consider the disadvantages of Frankston North and Carrum, of Hastings, Rosebud and Tutgarook and parts of Mornington. In fact, there's more social housing in Mornington, more social housing units in Mornington than Frankston North. Did you know that? Interesting, isn't it? And the kinds of indicators that we then try to cross-match are around unemployment, the numbers of children living in jobless families. We've been very interested in the data from the Australian Early Development Index, which is a survey done in 2009 and again in 2012 on all children in the prep year, which gives us very, very good data. It's excellent, world-class data on the readiness of children for school, which is of itself an indicator of their early childhood and the opportunities that they have or haven't had. We're interested in things like early school leaving rates, the number of pensioners in an area, the rates of chronic disease by a statistical local area. Homelessness is emerging as a big issue, particularly for Frankston, but actually for the whole catchment, we think, and we're putting a lot of work into getting a better understanding of homelessness and how we might meet needs better in primary health care for that population. And mental health, and that includes drug and alcohol, of course, and it will include family violence as we get a couple of new positions filled in the coming month or so. The rates for domestic violence, particularly in Frankston, are fairly disturbing. So Michael mentioned the 5 priorities that we've identified. We've actually renamed proactive health and calling it prevention and better health. We think that might be a bit easier to remember. And that position will include a couple of health promotion positions, which we'll be advertising shortly. So if you know anybody who's interested in those areas, watch this space on our website for vacancies. And we're about to put together high-level alliances around each of those priority areas to bring together the most senior people we can in the catchment to advise us on where we might and how we might be filling gaps in services as we identify them. And, you know, the service redesign issues that are at the core of what a Medicare local is about. So far I was quite surprised by this, that life expectancy rates are not as high in this catchment as the rest of the state. In the Mornington Peninsula Shire, it's slightly lower than the state average. In Frankston City Council, it's quite a lot lower, particularly for women. And we're not quite sure why that is the case. Perhaps this year, as we get more granular data from the ABS, we might be able to understand that better. But that's certainly an important indicator that all governments collect, and we'll be watching that one with interest over time. Overall, whilst we're often seen as a retirement heaven, that we have a high proportion of older people, and we do, we mustn't forget that we also have a lot of families and we have a lot of young children. There are slightly more children in the 0 to 14 years of age group than people aged 65 plus years. So we have to balance our resources across those key areas. And 32% of the population is aged less than 25. That's a little bit higher than the state average. That's particularly in the Mornington Peninsula Shire, but in Frankston it's pretty much evenly distributed according to the state average. So the population projections for the two local government areas show that for Frankston City, it's like the population is expected to increase by 1,000 people per year for the next 20 years or so. And for the Mornington Peninsula Shire, it's likely to be a little bit more than that, just over 1,000 per year. But the difference you can see there in the demographics is that it will be the older population that will increase in the Mornington Peninsula Shire, so it is a retirement heaven. And it will still be families who gravitate to the city of Frankston because, especially of the access it has to services and schools and the city and so on. So this slide, this slide shows that the Victorian average for the proportion of people aged over 65 is 13.8%, but in this catchment, in the two LGAs, it's 16.9%. But especially in the Mornington Peninsula Shire, we see huge growth in that, as the previous slide suggested. And as the baby boomers become older and then old, there'll be a little tsunami. And we need to be ready for it. And so people are expected to age in place, to stay on the peninsula. But the implications of those figures for services in the Mornington Peninsula Shire especially are obvious. It's interesting that Rosebud has the highest percentage of persons over 75 in Melbourne. The Mornington Peninsula Shire and all its townships are still considered to be part of Melbourne. So when you look at the different data sets, the data comes up in suburbs of Melbourne, and the rural regions come up as obviously as rural, but we're not classified as rural. And that's because there are obviously a lot of aged care facilities there, and women live longer than men. There are a lot more widows in Rosebud than in other towns, but it's interesting that that's where there is a high concentration. This slide is about the number of aged pensioners by statistical local area. So you can see that Frankston East and West and Mornington Peninsula East, South and West are the 5 statistical local areas. And I've highlighted there the number of pensioners in Frankston East and West. So despite the fact that Frankston doesn't have a particularly high proportion of older people, it has a very high proportion of people on the aged pension compared to the Mornington Peninsula Shire. So clearly income for older people is a real issue in the city of Frankston, and that suggests that there should be a higher proportion of beds in aged care facilities available for people on pensions, and that's the kind of thing that we really need to look very hard at to make sure that those people have access equal to older people in the Mornington Peninsula Shire. So 88.3% in Frankston East of older people are on the age pension, and 75.9% in Frankston West, which is significantly higher than the 3 statistical local areas in Mornington Peninsula Shire. And 71.9% for Victoria, so it is significantly higher, obviously, than Victoria. This slide shows the growth by 5-year or 4-year age groups, 5-year age groups, from 65 to 85 plus for the Mornington Peninsula Shire, and it shows that you can see where the growth is going to be, steady, but in fact it's steady plus, isn't it? It is still going to be steady. It's not going to suddenly rise. But we are going to see overall a 66% increase in the 85 plus age group, which is where, in fact, it's probably 80 plus where most services are concentrated, aren't they? And that tells us a lot about the kind of resources that we're going to need, and that we're actually going to see almost as many people in the 85 plus age group as the 80 age group, which is reflective of the period of people's lives when they move into the Shire. So what does it look like in aged care packages? There's a waiting list of about 450 people who are eligible for packages. 105 have been on the waiting list for over 6 months, and we understand from the team that some people are on the list for much, much longer than that. There are ACAS has approved 785 people for aged care packages in the last financial year. But it's not rocket science to see from the data that we're going to need to see a steady increase in the number of packages that are made available, especially in the Mornington Peninsula Shire, consistently for the next 20 years. We can't see no growth in that, form of support. I think the other really interesting thing about this catchment is that it's primarily Anglo. You know, you only have to walk around to see that, and then go to Dandenong Market for a bit of a shop, and you do notice the difference, don't you? We are one of the most Anglo areas in the southeast. We have, of course, a number of ageing Greek migrants, particularly around Rye, but we do have the lowest proportion of people from called backgrounds in the Victorian Southern Metropolitan region. That's not likely to change a great deal. It may change, you know, a little, but it's not likely to change a great deal. The growth we're likely to see in called residents is going to be in the families age group, I would think. Dementia, we have someone, Catherine here from Alzheimer's Australia, who's going to talk about this more, and this is what's called a synthetic projection, but in the report done for Alzheimer's Australia by Deloitte, the Mornington Peninsula Shire was ranked #1 metropolitan suburb for rates of dementia, and that is projected through to 2050. So if you're looking for a shift in career, just move into dementia, you'll be fine. We're the third highest in terms of absolute numbers of people living with dementia as well. So it's interesting to talk about ratios and proportions, of course, but the absolute numbers are really important. So we are embarking on a dementia study in more depth. We're keen to hear from anyone today. You can talk to Suzanne or Nick or myself if you're interested in being part of that. We're going to be doing a needs assessment that will lead to a strategy around dementia. It may be that everything's fine on the dementia front for people living at home. I see a few heads shaking and say it's not. And we'd like to know more about that. So we're aiming to have that report by June, and that will give some direction for how we plan into the future with that new ageing alliance that we're planning. So it's a major issue for us. Residential aged care facilities, I mentioned earlier how many, but I actually think it's not 32. I think you said it was 35, Nick, facilities in the catchment. And 619 community aged care packages. And how are they allocated? Well, we're actually below the Victorian average, which is disturbing given our population. So again, we're going to need some strong advocacy from United Voices to make sure that we don't fall behind any further on the allocation of aged care places for our population. We do see a high proportion of women in over 75 who live alone in the catchment, and those aged care places for Victoria are 41.7 per 1,000 population, and here we're seeing 39.7 in Frankston, very low in Mornington Peninsula Shire, 31.7. And the proportion who need them is actually 39.5. So there's certainly some work to be done there to ensure that we do get an allocation that matches our population. So that's where we're up to. We're looking forward to discussions today And as I said, we're intending to do a lot more work on needs. Some of you have already spoken with Suzanne about needs for psychological support in some residential aged care facilities. That's been a first step for us, but there's a great deal more to do and we're interested to hear your ideas. Thanks very much.